I'm Carla Holloway. I'm the James B. Duke Professor of English and a Professor of Law at Duke University. I've written on African American death and dying, and more recently on issues of gender and culture in death and dying in the United States. So I suspect my work on this panel, which I'm very excited to be a part of the committee, will be particularly attentive to those issues.
My name is Salim Amigo. I'm an associate professor of nursing at University of Pennsylvania and an associate fellow of bioethics at the Department of Bioethics at the School of Medicine at University of Pennsylvania. My specific area of interest and the expertise that I bring to this committee is around healthcare disparities and understanding sources of disparities in end-of-life pain and symptom management. Compared to the last report, which did not address disparities issues in general, I think we made a case for including disparities as a key area in this particular report. So,
my name is Diane Meyer. I direct the Center to Advance Palliative Care, a national organization located at the Mount Sinai School of Medicine in New York City, whose mission is to improve access to high-quality palliative care for all people with a serious illness and for their families, regardless of their age, diagnosis, setting of care, prognosis, but based on need.
My name is Eduardo Pereira. I work at the University of Texas MD Anderson Cancer Center in Houston, and I work at the Department of Palliative Care and Rehabilitation. My area of interest is support and palliation of distressing problems in patients and families, and I have had some experience also in developing programs in Canada, Europe, and particularly in the developing world, and those are, I think, the areas of expertise I bring to the committee.
Thank you. Thank you all for being here. I deeply appreciate your interest in the topic. My name is Pam Hines, and I'm a nurse. I'm a pediatric nurse researcher, and I work with children regarding their end-of-life care preferences. And I hail from Children's National Medical Center, where I'm the Director of Nursing Research and Quality Outcomes and the co-director of the Center for Translational Science and a professor of pediatrics at George Washington University.
Hello, my name is Christian Sinclair. I'm a hospice and palliative medicine board certified physician outside of Kansas City. I am currently the National Hospice Medical Director for Gentiva Health Services. My particular area of interest is the training of a professional workforce to provide good end-of-life care, as well as the concerns about potential shortages, and also interested in general public awareness and culture change outside of medicine.
Hi, my name is James Tolsky. I'm professor of medicine and professor of nursing at Duke University, and I'm also the chief of Duke Palliative Care. My work spans a number of areas, including quality of life toward the end of life, self-management interventions, palliative care interventions, but I'm probably most interested and have done the deepest amount of work in the area of provider-patient communication and enhancing that and in creating teaching interventions for communication.
Thank you. I'm Steve Parker. I'm professor of medicine and psychiatry at Tufts in Boston. I am in the Division of Clinical Decision Making there in the Department of Medicine. Most of the work that I've done relates to figuring out how people make decisions and how to make those decisions better. I'm very interested in patient-centered care, patient preferences, and optimizing the ability of patients to have input to decisions affecting their care.
Good afternoon. It's good to see a large turnout. Clearly, this is an issue that will affect all of us. I'm Fernando Torres Gill, a professor at UCLA in social welfare and public policy, and an adjunct professor of gerontology at USC, and also a member of the National Council on Disability. And my interests range from the policy side of aging to disability and long-term care. And it's good to know that we're starting to address a very important topic for the pending aging and actuarial inevitability of 75 million plus baby boomers. So this will be an important topic.
Good afternoon. My name is Pat Bamba. I am a board-certified internist and geriatrician, and I hail from upstate New York. I currently am a clinical assistant professor at the University of Rochester Medical Center and Upstate Medical University in upstate New York. I currently work as a medical director for geriatrics at Excellus Blue Cross Blue Shield, which is a not-for-profit health plan that spans 39 counties in upstate New York. Done that since 2000, but the majority of my time was spent in private practice, taking care of frail elders and their families for over 2 decades. In my current work, I lead a healthcare and community collaborative called Compassion and Support at End of Life. And we have been in existence since 2001 and have focused on increasing conversations among families around the kitchen table that would lead to completion of healthcare proxies. Also, another focus has been on ensuring that once people have these discussions, that their preferences would be honored. And out of that group came the MOLS program, the Medical Orders for Life-Sustaining Treatment program, which is now an approved program. It was one of the first 3 approved programs nationally that is really based on a set of actionable medical orders that all health professionals follow. We've also worked on community principles of pain management, which we've been doing for a decade, and provider education and community education. As an outgrowth of that work, I chair the MOLST statewide implementation team in New York and the National Healthcare Decisions Day New York State Coalition, particularly working through, and I would say, working with consumers as part of this effort. So I'm particularly interested in the comments that will be shared this afternoon and those that will be shared on the website. I think the summary, in terms of looking at this community work, it's very important for us to focus on provider training for all new professionals, as well as bridging the gap where we didn't have it in terms of professional training, ensuring that people are educated from a consumer perspective and empowered to help make shared informed decisions as it relates to end of life. And as part of any of our processes, we go forward looking at the opportunities for system implementation and quality improvement. Thank you.
Good afternoon. My name is Jean Kutner. I'm a professor of medicine at the University of Colorado School of Medicine. I am a geriatrician, general internist, and palliative medicine physician, and have research interests in enhancing care for people with serious illness, focusing on family caregiver support, symptoms, and ways to integrate palliative medicine throughout the continuum of care. Thank you for coming.
Good afternoon. My name is Naomi Harp. I am a lawyer by training. Currently, I work in the Office for Older Americans at the new federal agency, the Consumer Financial Protection Bureau. But for the past 30-plus years, I've worked on issues at the intersection of law, aging, and public policy. And during that time, I've spent a lot of time doing qualitative research and advocacy around issues such as advanced directives, advanced care planning, and ensuring that the wishes and preferences of people who can no longer express or make those decisions themselves can be carried out. So I think it's important for, as part of this charge, that we look at those issues. I've also done some looking at the PULSE program, Physician Orders for Life-Sustaining Treatment. MOLST is one of those. They have different names. And that is an interesting paradigm I think this committee should look at as well.
Hi, I'm Judy Paris. I'm a clinical social worker serving Medicare beneficiaries, and I'm currently doing policy work with Joanne Lynn's Center for Elder Care and Advanced Illness at the Altarum Institute. I have decades of research that I've done in Medicare and Medicaid policy. In particular, though, as a social worker, I'm concerned about the psychosocial aspect of care near the end of life, and I have an expertise at the nexus of long-term care and palliative care.
Good afternoon. My name is Chuck Fahey. I am a Catholic priest from Syracuse, New York, and I've been hanging around this field for the last 54 years.
That's it? And he's so accomplished. My name is June Simmons. I'm from Los Angeles. I'm a social worker by training. I'm the founding CEO of Partners in Care Foundation, not-for-profit that looks to change the shape of healthcare around home and community services. So we look for evidence-based models of care, and we've done a great deal of work, specifically with Kaiser in the beginning, to address home palliative care. We have a long history of looking at enhancing quality of life, capturing the best health at all stages, and bringing us from the presenting problem to the presenting person, looking at the whole person in full dialogue and having the opportunity to make decisions, informed decisions about the course of how they manage their health and their care. And Kaiser adopted that home palliative care benefit, and we've been working to move that forward to other settings with other financing structures. So we're very excited in this historic moment of health reform to be working to move that and other models of evidence-based care forward to really transform care for those who need it most, which this population does, focusing then on the dually eligible demonstrations, on accountable care organizations, on primary care redesign, the medical home, managed care, all the places we can find where we'd have an opportunity to really take money back from driving the occasion and look at best results for people's lives out of their care.
Good afternoon. My name is Bernard Lowe. I'm president of the Greenwell Foundation. Our mission is to support bioethics research. Prior to that, I was professor of medicine and director of the program in medical ethics at the University of California, San Francisco, where with my colleagues I conducted research on how to improve decision-making for seriously ill patients and their families, and also to improve doctor-patient communication. I want to thank all of you for coming, and we all look forward to hearing your ideas and thoughts.
Good afternoon. I'm Joan Tino. I'm a health service researcher, physician, hospice medical director. It is a privilege and an honor to be among this wonderful group of people. We have a really tough task ahead of us, is to think about how we can structure the healthcare system to provide care that's competent, care that's compassionate, care that is coordinated, and care that is centered on the needs of seriously ill patients and their families. And I look forward to receiving your input this afternoon.
Good afternoon. My name is Leonard Schaffer. I'm a professor at the University of Southern California. I've worked in the in state government, in federal government, and in the private sector. And I'm interested in the economics of healthcare and in the public policies that can help care be delivered more accessibly and with higher quality.
Hi, I'm Bill Novelli. I'm at the Business School at Georgetown University. And I also co-chair CTAC, the Coalition to Transform Advanced Care, which a couple of weeks ago had a national summit on this issue in this very building. And I think I recognize a few people here who were there during those 2 days. I'm extremely proud and pleased to be on this committee, and I say that for at least 2 reasons. Number one, I think that the time is now, the time is right to really reform and transform advanced illness in this country. And secondly, with the prestige and the credibility of the Institute of Medicine, and with your input, hopefully we can do a really, really terrific report that will have influence on policymakers, the medical and the health community, the employers in this country, and others to make a difference. Thank you.
Because of the efficiency of my colleagues, we are well ahead of schedule. So I consider that a plus, which means that we now can go to the next portion of our open session agenda this afternoon, which is hearing from a variety of stakeholders who have requested to testify. While they can present longer testimony, we've asked that each of the persons that appear limit their oral remarks to 3 minutes. Somebody presumably will be watching that 3-minute time frame, and I will try to enforce it to the extent necessary. We've got a total of 13 persons that have signed up in advance to be able to do this. We'll start with Susan Friedman, who's Deputy Director of Government Relations for the American Osteopathic Association. Susan, if you could come up and, what do we do it up here? What the heck, why not? Come on up here, Susan. And if those of you, do you have a copy of the agenda? Does everybody have a copy of the order of speaking? Yes. Okay, fine. Then if those of you that are close to the beginning, if you can move up to the front so we can minimize the amount of time that we have of people going back and forth, that would be appreciated. People that are speaking, please come up front. Thank you very much. And Susan, please proceed.
Thank you.